Fungai Munyeza, who lives in Zimbabwean capital Harare, says she was diagnosed with breast cancer in 2017. Munyeza says Zimbabwe's public hospitals did not have the equipment to treat her, and care in a private hospital was too expensive. So she sought treatment in South Africa, where she was declared cancer-free.
Because if I didn't have money, I would be gone. I would be gone because the treatment is expensive. So I would say my survival is mostly on my positivity and also on the types of regimes that I received.
The Zimbabwe National Cancer Registry's latest report issued in October says of the more than 7,000 new cancer cases reported each year in 2018 and 2019, 1,000 patients died of the disease.
In terms of cancer deaths, the leading causes of mortality, according to the report, are cervix. So cervix was by far the leading cause of a cancer. This was followed by prostate, and then esophagus, then breast and liver.
The non-profit group, the Cancer Association of Zimbabwe, says most types of cancer are curable, but the report suggests patients are not getting treatment until the cancer has reached its final stages. Love Mo Makurirofa with the Cancer Association of Zimbabwe is calling on the government to do more to stem the rate of cancer deaths.
Also need a sustainable funding mechanism, a domestic funding mechanism that is very sustainable, which will make sure that cancer programs are implemented extensively in the same way HIV and AIDS activities are being implemented.
Munyeza says cancer treatment in private hospitals is more expensive than seeking it abroad. She says cancer patients end up going abroad for treatment if they do not have funds to seek medication in private hospitals. For those who cannot afford to seek treatment elsewhere, Munyeza says the outlook is grim.
And remember, in Zimbabwe, there are only 2 radiotherapy machines. And of the 2 radiotherapy machines, they are all down at the moment, one in Blue and one in Harare.
In a brief statement to VOA on Monday, the Zimbabwean Health Ministry said the radiotherapy centers in Zimbabwe are being resuscitated and will be functional soon. Muturi Ncube, Zimbabwe's finance minister, last year introduced sugar tax to raise funds to improve services for cancer patients. So far, that revenue has not yet been distributed for cancer treatment services. Meanwhile, Munyeza says she plans to travel to India for more testing to ensure she remains cancer-free. Columbus Mavunga, VOA News, Harare, Zimbabwe.